Welcome. Let's talk about when it is appropriate to repeat a sleep study. Honestly, there's no real reason to repeat a sleep study unless the patient has new symptoms or recurrence of old symptoms. So you first have to figure out is what the old symptom or the previous symptoms that led to the first sleep study was. And if they have a recurrence of that, for example, snoring or waking up startled, or even if their loved one or bed partner says that they are tossing and turning in bed more frequently, like how they used to, you may want to repeat a sleep study. So that's a recurrence of old symptoms. Now, what about new symptoms? New symptoms would include, for example, insomnia. For example, if the patient had snoring and waking up multiple times a night, snorting and gasping, and now they just kind of wake up once in a while more frequently, these new symptoms may mean two things. They could either have a superimposed change in their lives, for example, new medication change, changes in their dietary habits. They could also have recent traumatic or psychological events that cause insomnia to occur. So these are some of the newer symptoms that may be unrelated to their sleep apnea, that the reason why they got on the CPAP in the first place. But some of these new symptoms may also be part of the constellation of symptoms related to their obstructive sleep apnea. So you need to delve a little deeper into it, figure out if it's an equipment problem, whether it's a machine problem, whether the machine's working fine, whether they're using the humidifier, whether the mask fits well. And those are some of the troubleshooting tips that I could suggest, especially if they have new symptoms that you can't really put into a proper box or correlate with previous symptoms. But generally, you don't need to repeat a sleep study unless, of course, you have a recurrence of old or you have a occurrence of new symptoms. The other thing is to take note of is weight gain. Generally, the general wisdom has been a gain of more than 10% of their original body weight during the sleep study, and that may mean that the CPAP pressure that they're on may be inadequate to alleviate or abolish all the obstructive events. So if they have a weight gain of more than 10% in these patients, and you can't really tell whether symptoms have improved, a repeat sleep study may be warranted at this time. Some physicians as well automatically get a repeat sleep study, but I think it needs to be related with symptoms. If the patient feels the same as they used to, I'd be hesitant to repeat a sleep study for the sake of just weight gain. Another thing that we need to be aware of is change in their cardiopulmonary status. Now, people do change. A previous cath may show no or clean coronaries, and 5 years later they may have not so clean coronaries. So if someone's CPAP study or sleep study was done a few years ago, and currently they're complaining of symptoms such as waking up gasping, which may not have been part of their initial sleep apnea symptomology, or you have patients going in for heart failure to the hospital, or worsening of their COPD or asthma, and having or even suffering from respiratory failure requiring the ventilator. At this point, this change in the cardiopulmonary status definitely warrants a repeat sleep study to see whether the patient is still being adequately treated for their sleep apnea, or whether sleep apnea is converted from just a plain old obstructive sleep apnea to obesity hyperventilation, for example, or someone with primarily obstructive sleep apnea now develops heart failure or atrial fibrillation, and then they just start developing central sleep apnea, and the CPAP machine or AutoPAP machine isn't as useful as it once was. So cardiopulmonary status change has to be taken into account. Now, if someone's already on CPAP or AutoPAP, you can run the sleep study at home with these patients and this device called the Braybon. I have no financial declarations. I wish I did, but I don't. And the Braybon device hooks up to the CPAP machine to give you an idea of what the true AHI or apnea-hypopnea index is. Now, this is extremely different from the download or the information from the smart card, because that's from the machine itself, and the machine AHI is notoriously poor at detecting changes in these patients. So if the symptoms do occur and you check the compliance down on the AHI shows less than 5, if the symptoms suggest worsening respiratory function during sleep, or even patients complaining of recurrence of old symptoms, I would definitely suggest repeat a Braybon with the CPAP study, with the CPAP at home. The other option, obviously, is to have these patients come in for an in-lab titration. Now, at this point, it's going to be a matter of personal preference whether you get a CPAP titration wherein the patient just starts off the sleep study with the CPAP mask on at the current setting at home, and just to assess and see what changes. Now, if the patient loses weight or has lost some weight, or the patient was previously on opioids or narco and so on, drugs that may suppress their respiratory status, making their respiratory status or sleep AHI higher than anticipated. Now they're off it, for example. So weight loss and change in medications, for example, may portend that the symptoms that have occurred now may be related to the fact that the sleep study or the sleep apnea isn't as bad as it was. You may want to consider in these patients to do a split night study. Split night in the sense that they'll run the sleep study initially without the CPAP machine, and if they meet criteria for starting the CPAP, they'll go ahead and start that. So you can run that as a split night, especially if they have weight loss or changes in medications and their lives are better now and they're feeling better and so on, and they have recurrence of some of the symptoms that cause poor sleep. A split night may be warranted. You may want to put a lower threshold for the sleep lab to start the titration or the split at AHI above 10. Most of the time they'll start at above 20 or even above higher than that. So the patient has mild to moderate, they may not split them in time, and you may end up having to have the patient go back in for another sleep study for CPAP titration. So if they already have the CPAP on and they have some of the symptoms recurring, I'm going to repeat myself, you can go ahead and do a split night study if you suspect that sleep apnea has improved, and set the split night with a lower threshold of AHI above 10. Now, if you feel like the patient definitely has sleep apnea still, and you just think that the pressure needs to be higher, you may go ahead and just start them on a CPAP titration. You can start them at a value of 2 to 4 centimeters of water below the current CPAP value, or you can even start them at the current CPAP value that they use at home and monitor them in the lab itself. So those are the general reasons why you would repeat a sleep study. And I'll just recap that. Spoke about it, the need to repeat a sleep study. There's no general need to repeat whether 1 to 2 years. There's no such thing as that. However, if they have recurrence of symptoms, if they have new symptoms, or recurrence of old symptoms that affect sleep, once you've troubleshot all the usual causes, equipment and medication change and overall lifestyle changes and so on that may affect their sleep quality, at that point a repeat sleep study may be warranted. The other issues that may come into play is weight gain in these patients. More than 10% of their body weight may warrant, especially if the symptoms do occur, if they complain of the unrefreshing sleep or recurrence of that. And the other one, a big thing as well recently, as we find patients are getting sicker, is changes in cardiopulmonary status, whether admissions for heart failure or COPD exacerbation, the cardiologist having to ablate their atrial fibrillation, for example. This may all indicate that their sleep apnea may be somewhat contributing to their worsening cardiopulmonary status, and repeat sleep study may be warranted at that point. And then from that point of view, is to figure out whether they need a CPAP with a Brabon study, in-lab CPAP titration, so CPAP at home plus a Brabon, or you can do an in-lab study where you either do the CPAP titration or you do a split night. Alrighty, thank you.